Hi, my name is Dr. Rajat Ahmed, and I am a consultant psychiatrist working in UK. And with me this afternoon is Dr. Tayyab Chadhary. Dr. Chadhary, I met him a few years ago when he was working in our trust as on a psychiatry post, and he was always interested in GP training. And for the last 1 year, since the 2019, August 2019, he's been training as a GP in north of England. So I thought it would be a good idea to invite Dr. Chowdhury and speak to his experience about securing the GP training, and then some other questions about how is he finding the GP training so far. So Dr. Chowdhury, thank you very much for joining me this afternoon.
Thank you very much, Dr. Adnan, and thank you for inviting me. It's a great platform, and I see that you have done different specialities with different doctors at helping the IMGs. It's a very good platform from them. So I'd just like to share my experience, and thank you for inviting me.
Thank you for joining me. So if we start by asking you about your experience of how did you join the GP training, what is the process of it? And if as IMG is thinking about it right now, what should they be doing about it?
So yeah, it's a very good question to start with GP training. So a lot of IMGs that come here have this question that how do we get into the GP training, and how does the system work? So basically, there are a few eligibility criteria that we should be aware of before starting the GP training. One is that you need to have your foundation competencies, or now it's called a CREST Form 2020, that you need to be signed from any consultant under which you work for more than 3 months that can sign off those competency. That's a very necessary thing. The other thing you need to enter a GP training is a minimum of 2 years of experience post-graduation. So a lot of us IMGs, we do our house job back in our home countries, and that's a 1-year training or house job. So you need to do at least 2 years, because in UK, there's foundation year consists of 2 years. So for IMGs, I would say that 1 year of work experience apart from their house job, whether in their home country or even in abroad, would be necessary for entering the GP training. And the third important thing is getting the ALS done. ALS is also a criteria for getting into GP training. So as soon as you come here, while you're working, arrange yourself, do an ALS course. And probably that is it. Once you've met these eligibility criteria, you've got all these 3 things. What the next step is to apply. So in UK, there are 3 process or 3 times that you can apply. 2 rounds, but 3 times that you can apply during the training. Round one re-advert, which you apply during the year, and the training starts in August. And then round 2, in which the training starts in February. And there are 3 process by which you enter. So first of all, you apply with these simple eligibility criteria. You submit your application through Oriel account, which is managed by the National Deanery and GPNRO. And once you've applied, they will longlist you. There would be a long listing. Once you've been selected to that criteria, the next thing you can, they will give you a date for an MSRA exam. You book your MSRA exam. Everything is free. There are no charges for any application, for any exams. All is governed and given by the GPNRO. So once you book your MSRA exam, you'll get your results within a few weeks. Once you have your result, there are 2 things. If you score more than 550 marks, you will get your offer directly, and you don't have to do any more tests or exams. But if you score less than 550, which most of us do, you will have to go through a stage 3 exam, which is just more like a practical exam, in which there are 3 stations like lab 2, with a colleague, with a patient, and with a family relative, and then a written task where you prioritize these things. It's a rather simple test. And once you've gone through all these process, you will be shortlisted and then given an offer based on your preferences. Wherever in the UK you've chosen your preference, if the seat is available according to your merit and everything, they'll give you an offer, and then you have a time to select and then process your visa and everything with it.
That's fine. Thank you for informing us about the process. And I think you mentioned the 24 months experience which you require to as a minimum to enter. And as you said, 12 months could be the internship. But other 12 months, if you haven't done in the home country, I just wanted to say they don't need to be training posts. They can be non-training posts within the UK. That could be in any specialty, could be medicine, A&E, or wherever, or even psychiatry, wherever you want to do your 12 months. And then you need a
Absolutely.
CREST form as well.
Absolutely, absolutely. There's no restriction. It's just an experience that they require. So it doesn't have to be a training post, non-training as a SHO post, um, any specialty. Like I did, I worked with you in psychiatry during those 6 months. I did general surgery before that. So any post, yeah, it's just the experience they require.
And a lot of IMGs are quite interested in the GP training, and they always ask, what is it like to be a GP training? You have done a year in GP training, which I understand included a hospital post and also a GP placement as well. How did you find it?
Okay, so yes, that is a very regular and a very routine question. People do ask that the GP training, how is it? So I've, to be honest, I've really enjoyed it so far. My journey in the GP training, my first 1 year, I had my hospital post, I had my GP post, so I know both, and I can see the difference now. What's the differences? So GP training, why I like it is because it's a very like any other training specialty in the UK. It's very well organized. You've got your regular teachings, which I found very interesting in the GP training. Uh, you have a very good connection with your ES and CS with them. And working in the GP placement, you realize that this is what you're going to do throughout your life now after completion of your training. So the training is really good. It's quite extensive. It is vigorous. Um, People think that it's a 3 year training and it's an easier training to do. There are a lot of competencies and capabilities that you have to sign off, but it's manageable. It's good, and I'm really enjoying it.
And as a part of training, I understand you have to pass your ARCPs, annual review of clinical competence every year. For
Yeah,
that, you need to maintain a portfolio and do certain competencies as well, as you mentioned, workplace-based assessment and tick off some of the required competencies. There is always an exam, that you have to pass as well to be qualified as a GP. So, how many parts of the exam, and is that something that IMG find easy or hard?
okay, so MRCGP consists of two parts. One is the written exam, which we call the AKT, Applied Knowledge Test, and then the second one is the CSA, which is a clinical, practical kind of test. So there are two parts of MRCGP that you have to do between these 3 years. You can't give any of the exam in your first year of training. So you're eligible to give your AKT, the first part one, in your ST2. It's a clinical based question. There are a lot of online resources and different private organizations that help you prepare for those. So you can be eligible or try to do from one of those. It is, as I've asked my seniors and colleagues, it is quite a difficult exam. But it's not that IMGs only face this as a difficult exam. It is generally for even for the students or colleagues that have worked here or studied here in the UK. They also found it quite difficult. So you're eligible for your AKT exam in your ST2, and once you've done that, then in ST3 most of the people give their CSA, which is the final exam, which is considered to be more competitive because it's more practical. But there are a lot of resources. Your educational supervisor, who's also your clinical supervisor in ST3 in the GP practice, helps you through it. There are a lot of opportunities for making it work. So it is difficult, but it is manageable. It's possible. Yeah.
And if we talk about, a lot of IMG's have different questions about the GP training and what life as a GP in UK, so if we talk about the advantages, and then I'll post some of the questions which they ask around negative aspects of it as well. So if we talk
Yeah.
about advantages first, in comparison to a hospital consultant, what are the advantages which generally people feel that to become a GP? One of the things you mentioned is obviously the training is shorter. If you're comparing it to other specialty training, is only 3 years in GP. others could be 6 years, 8 years, 7 years, you know. So is there any other advantages that you see or you sort of find out?
Yeah. So yeah, the number one advantage is it's a 3-year training program. Others are 6 and 8 years, and only few of these 6 or 8-year training programs are run through programs. Most of them are not run through, so you have to apply twice, and it's quite a cumbersome and long process. So the time scale is one. The other, I think, is it's the training is vigorous and tough, but once you're a GP, you've got a good work and life balance. You can choose your own days. You want to work on the weekends, you want to work on the weekdays, it's up to you. uh, and you can also limit the number of days you want to work, 3, 4, 5 days. There's no hard and fast rules, but most of the GPs, they work during the weekdays, the weekends are off, bank holidays, so it's a very good work and life balance. And contrary to the hospital consultants I see in the hospital, when you're on call out of hours, most of the people don't like that. That is the one thing that pushed me to be a GP. So that is one of I think so a good benefit. And then the other pros of being a GP is that you're not limited to that particular specialty. So if you've got an interest in anything, say for example rheumatology, you like to do rheumatology, you can be a GP with special interest in rheumatology. You can get your competencies signed and then can run special clinics even in the hospital. So if you're feeling that I would like to do work in hospital for some time, so you can go in hospital and work in clinics, special clinics for that, for which you can have to get just your competency signed off. The one of the very good pro is that you're not limited. You can do anything you want, and you've got a good opportunity for that. And yeah, that's pretty much it, which I pushed me to be a GP.
And some of the negative things people talk about, they think that GP works in a very isolated position. You know, they feel that hospital doctors or hospital specialists are always surrounded by teams, and you know, there are wards, and there's always this environment. Their social environment is also there around them, and they feel the GPs are very restricted to their own room or own practice. Sometimes, you know, so they find this could be very isolating for them. How do you feel about that?
Okay, I'm glad you asked these questions, because this is one of the questions I do see a lot, and people ask me these questions a lot. Yes, people think that hospital, you've got a team, you're working in a team in the ward, everyone is very well communicated and well connected. But I find this on contrary. I've worked in GP, I've worked in hospitals, so I know how it works. I found GP practices to be very effective in communication and in close proximity to each other. There's always this morning coffee break. There's a slot reserved for all the GP practice. In the practice, they've got a special coffee room. They sit there. They discuss anything about, if they want to, about a patient or any problem they're facing, or even out of work, anything what they were doing over the weekend and anything. So it's a very good, comfortable environment where all the colleagues come together. And plus, there is a team. There are your secretaries, there are the receptionists, there are specialist nurses in the practices. And I think that it's a very well connected form of cloud that they share with each other. And I don't find myself lonely, or find myself separated from people or different from hospital. In contrary to this, in hospital, when I'm on call, doing my on call, I'm just alone. If I'm in a specialty, I'm just alone, sitting alone. There's no one to talk to, and I'm just busy doing all the stuff. But obviously, that's different for different specialties. But I would say it's just a myth. You find people, there's a very good relationship between the colleagues, and it's a really good environment to work in.
And then other commonly asked question from the IMGs around going back to their home countries, because a lot of people, for example, they come from India and Pakistan, and they always ask you, if I've done GP training here, got my all exams, become a GP in UK, what would be my scope abroad? You know, if I have to go back to my home country, or even other countries, Middle East or other English speaking countries, they always ask about that. So have you ever explored that? as well?
Yes, absolutely. As you know, I'm from Pakistan, and obviously there is always this concept or thinking behind our back that, well, what if we move back, and how will we manage, and how will we practice the specialty? So it's a very commonly asked questions, and how I see it is, uh, primary care or general practitioners just not limited to the UK. It's practiced all over the world, even in our country, Pakistan. Uh, it's mostly called as family medicine or as primary care physician. You can name it whatever you want. But the scope is not limited. As I mentioned earlier, if you have a very special interest in anything, you can always move back to your home country with that special interest and can work. I have colleagues, I know people that are working, they're poor GP with special interest, and they're working as a specialist in their country, which to be fair is very common. Plus, even if you don't have any special interest, if you just simple GP, you can work in Australia, Canada, Middle East. All the countries have GPs and primary care, so you can always work there. The other thing is, it's just that you need experience and you need your full UK competency signed off to work in those countries. But there is no limit to GP training or GP specialty. Primary care physicians are present all over the world. So I don't think so they're limited or they won't be able to survive or work in any other country. Actually, they do quite well. And I know quite a lot of people who are working in Middle East and other countries. So, and they're really happy with the job.
And then another last myth, there is always this idea that GP training or life as a GP is easy. As a GP, as a doctor, they are not doing much, or this is a sort of an easy life in hospital. Everything major is coming to hospital. So I think that is obviously I know how busy GP could be, and this is something, this myth should be sort of addressed as well. What is your experience on that? What would you say to that?
Yeah, another very good question. Yeah, and very common question. So yeah, people think, let's do GP. I'm fed up from hospital. It would be an easy training. Let's just get into the GP training. I tell all of my friends and colleagues that after working in the GP and working in the hospital, GP training it's 3-year training, but it's quite vigorous. It's quite tough, especially when you're in a GP practice. You've got 10-minute slots with your patients. So, and patients come with a lot of issues. You have to deal with their social aspects. You have to deal with the medical aspects. There are different problems to it. And all your slots are already booked during the day. So it's one after the other. So it's quite big. Then you have to go for your home visits, then you have your afternoon sessions. So it's quite busy. It's not at all an easy or easy to get in training, or even once you're full qualified GPs, it's quite a busy life. But the good thing about it is, yes, it's quite manageable. The work-life balance and work hours, you can manage according to your routine, your family routine, your family commitments. So it gives you that edge over the other specialties or hospital specialties, to easily rotate your circle or life around that. So that is one of the benefits for it. Yeah.
And if an IMG is currently a junior doctor, they're working in their home countries, or even medical students, they're thinking about GP seriously. What are the things they should be doing? Because I understand there is no need to maintain a portfolio if you are applying for the GP training, because there's no portfolio station, which we have to find in other specialties, like if you're applying for psychiatry or IMT training. But I still advise my junior doctors to always keep a portfolio, because you never know, you might not be able to get into GP training. You might have to apply for a different specialty. But generally, what is your advice for people who are here or abroad? What should be they doing sort of to improve their chances to get into GP training?
So as you mentioned, yes, there's no portfolio requirement for GP, which is quite good, and you don't have to hassle around the portfolios and getting things done, collecting certificates or experiences, which is a good thing for GP. What my advice would be for any IMG or anyone thinking to get into the GP training would be, first of all, primary care, family medicine, any experience they can get into that, doing clinics more and more, because GP is all about clinics. You're art at doing clinics. So if you're good at doing clinics, then yes, you can work well in GP practice. So your experience and art and skills in regards to your clinical examination, that would be quite helpful. Then there are few uh, good resources available on the RCGP websites, free learning modules. You can always read that. That will help you once you start your GP placement. That's quite helpful, which I wasn't aware of, but I tell my colleagues and anyone who wants to start GP, have a look through that. That's quite helpful, and you know what you're going to do. There are resources all over the internet for home visits. There is for telephone triage and consultation, which is a new thing with all the COVID. So all these resources are available on the RCGP website and other websites. The other thing which I advise anyone to start in the GP training, I always advise them to have a taster week or a placement in the GP. It's very helpful. You know what you're getting into, and then you don't regret if you do, if it's not your cup of tea, if you don't like it, then obviously you have a chance to go into some other specialty. So I always, and it's not related only to the GP, my advice to all the IMGs is whichever specialty you want to work, give 6 months, a year in that specialty just to see how things are.
Hello.
Yeah, yeah.
Thank you very much for all your advice and ideas. I'm sure it will help a lot of GP trainees or the junior doctors looking into going into GP training. So thank you very much for joining me today.
Oh, thank you very much for inviting me, and I hope it helps anyone that sees it. Yeah.
Thank you.